on January 18th of this year, I donated my kidney to my mom. My mom abruptly found out that she was in stage 4 kidney failure and that she would need a transplant. I didn't know much about it until this all happened, and I was surprised that you can live a full and normal life. The only thing is you have to monitor your water intake. Other than that, you don't have to make any real lifestyle changes. We coordinated it with her transplant center. It was kind of cool. I actually haven't known that much about my health until I went there. They do like a full workup, lots of blood work. It was a pretty seamless process. I think that it was a lot less invasive. The recovery wasn't really bad. And I think if you're considering it, then go for it. It's really rewarding.
Several years ago, my husband had surgery and found out he was having some kidney issues. During the follow-up, they discovered he had an autoimmune disorder for his kidneys. I was approved to be a donor, but it did not match. We were entered into the paired exchange program. That means somebody else would donate a kidney to my husband and I would donate my kidney to somebody else. Nice man came into the transplant center and to donate a kidney and match my husband. And so my husband got his kidney and my kidney went to another recipient. My surgery was laparoscopic, so it was also pretty easy recovery. And it's been almost 3 months for me now. And so I feel normal and back to myself. He was able to change our lives and the lives of whoever got my kidney. And so for me to be involved in both sides, like I saw my husband struggle and how it changed his life. And so I say do it.
Wow, what wonderful and powerful stories. We really want to thank those caregivers for sharing their stories as living donors. And we're so glad to hear that they and their families are doing so well today. It is April, and that is Donor Awareness Month. And so we would like to share some information about why it's so important to be an organ donor, what the process is, and tell some more stories about what it's like to be a living donor. So today I have with me Jamie Campbell, the president of Platte Valley Hospital, and Jennifer Prince, who is the CEO and president of the Donor Alliance. So thank you both for being here today. If you could just tell me a little bit about yourself.
Thanks so much for having me. Jamie Campbell, president of Platte Valley Hospital in Brighton, Colorado, and I've been in the role and in Colorado for just about 2 years.
And Jennifer, tell me a little bit about yourself.
I'm thrilled to be here. Thank you very much for having me. Jennifer Prinz. I have the honor of serving as President and CEO for Donor Alliance. We're the organ procurement organization who serves Colorado and nearly all of Wyoming. I just actually celebrated my 30th year of being able to do this work earlier this month. I'm also a donor family member and a recipient family member. So thanks for having me.
Wow, that's wonderful. And congratulations on 30 years. That's really impressive. So Jamie, as a living donor yourself, we'd love to hear your story. Could you share how you came to donate a kidney to your uncle, what that process was like, and what it meant to you and your family?
Sure, I'd love to. So just about 28 years ago now, I was informed that my uncle, who I was very close to my whole life, was going to need to be put on dialysis to manage his polycystic kidney disease. PKD is a genetic disease that my mother's family suffers from, and you either have it or you don't. So my mother and her children do not have PKD, but my uncle did. About half of my mom's relatives have PKD, so the transplant rate in their family is very high. At the time that my uncle was put on dialysis and placed on the list, he deteriorated rapidly. And I had just heard about the living donor program at UCLA. And at the time I was not connected well at all in the healthcare industry. I was still in another career in construction, my former life. And just doing some research, I picked up the phone and called UCLA and asked if I could talk to someone in the living donor department, and got connected with a wonderful transplant coordinator named Karen. She thought it was so interesting that it was a cold call, asking the question. And we started forming a relationship. It took about 8 months to get through the process at the time because it was so new. There were really only a few programs actually doing living donor transplants at the time. So about 8 months after I called and inquired, my uncle and I found ourselves at UCLA, and I was donating a kidney. And I think the experience was really impactful to my family, especially my mother's side, because after that, several of my cousins started donating to their mothers, fathers, aunts, uncles, brothers, sisters. So it's, living donation is just a way for families who can make an impact to just help keep each other going and keep the family sustained, and at the same time, make room on the donor list for those that do not have the option of living donation.
Wow, so you really started a family legacy.
I did.
Wow.
I did.
And that impacted more than just your family, it impacted your personal trajectory, right?
Totally. After an experience like that, when you realize that you truly can save someone's life, it's a different way of helping a person. And then you see the impact on everyone around them. My uncle's children, he now has grandchildren that he's able to play with and take vacations with. And we still see each other frequently when I go back to California. But, he's doing great. I mean, the quality of his life not only improved from, the time that he was sick, but it just improved dramatically, and he's been able to live this full and complete life. And once you have that experience, going into healthcare, was just a natural for me. I started by volunteering with the organ procurement organization, like the one Jennifer runs here in Colorado. And then I began volunteering and working for Donate Life California. We started the living donor, or actually the organ donor registry, the whole thing, when I was there in the late 90s and early 2000s. So it has completely changed my life. It's just made it so much more meaningful.
Wow, that's amazing. To think that there wasn't a time when you could just sign up for a registry. I know it's on my driver's license. It's easy to opt in Colorado and do that ahead of time so that people know what your wishes are. So let's turn over to Jennifer and talk a little bit about how we do this work here in Colorado. So what's the need? Tell me about how many people need organs right here in our state of Colorado.
Absolutely, and I would love to talk about that. Jamie, I have to say though, hearing your story is really phenomenal, and thank you for sharing. And I can only imagine what your uncle's life is like and your family's life after hearing that. So thank you, and to all the living donors that are out there in our community and across the U.S., what a difference it makes. So thanks for sharing your story. And the need is great. It's great here in our region. There are about 1,300 people waiting today for a life-saving organ transplant on the deceased donor list, and nearly 100,000 people waiting across the country. That's why things like National Donate Life Month and any opportunity that we get to talk about the need and joining the donor registry and how important that is, we take those opportunities. I love it that you mentioned your driver's license and signing up on the donor registry. Coloradoans typically lead the way here in the U.S. Colorado is usually one or two in the states for leading in donor designation. About 2/3 of the community say yes when they go in to get their driver's license or state ID. About 66% of us have that heart on our driver's license.
Oh, that makes me so proud. That's so great.
Yes.
Well, what are the different types of donations that come with this registry?
Right, people have the opportunity to save a life through heart, lung, kidney, liver, small bowel, pancreas donation and transplantation. Also to give the gift of sight through cornea donation, or to save someone who may have bone cancer or suffer from a trauma or a significant burn through a burn skin transplant or a bone graft donation. There are many ways that we can save and heal lives after our death to be able to help someone in need.
So what steps can someone take to become an organ and tissue donor?
The most important thing someone can do is to make that decision when they go in to get their driver's license or state ID to say yes to saving a life and signing up on the donor registry. If somebody's thinking, oh, I don't go to get my driver's license for a few years, what can I do? They can go to donatelifecolorado.org right now and sign up on the donor registry, and then to tell their family to go ahead and let them know that they've made that decision, because they can have that ripple effect, have that family conversation that can then lead into more conversations throughout their family, and hopefully others would make that same decision.
And it's so impactful and so easy. What are some of the misconceptions that lead people to not taking that easy step?
You know, sometimes people think that maybe they are their age, they're too old to be a donor. And we talk a lot about how older adults save lives every day through liver donation and kidney donation at the time of their death. So we talk about that out in the community. Some people think they're too sick, and they wonder if they have a particular disease process, like if they've had hepatitis in the past, maybe they shouldn't be a donor. And actually, someone can be a donor who's had particular diseases. So we take a look at that at the time of death and evaluate every potential donor, because the need is great. Those 1,300 people who are waiting in the region, they need us to see how we can possibly save their lives.
So speaking of that, how do you work with the hospitals and healthcare facilities in the work that you do? Tell me about that process.
We have a fantastic team at Donor Alliance. There are almost 200 people who work for the organization, and then we have 150 Advocate for Life volunteers between our two state area. But our team works with our donor hospitals, our partners, and hopefully there's some donor hospital staff that are going to see this video, because we're very grateful for the bedside care providers, our nurses, our physicians, respiratory therapists, all of those people who are involved in identifying a potential donor, making that referral to the organization, to Donor Alliance, letting us come in and see, does that patient maybe meet potential to be an organ, eye, and tissue donor, working with the family when that's appropriate about the donation process, talking to them about what that looks like, and then working together to make sure that we can honor that donor's gift of donation all the way through to transplantation.
Great. Well, what can we do as individuals to raise awareness about the importance of organ donation?
I say talk to everybody about that heart on your driver's license. Some people will say they've got that small little heart, and that's a small but mighty heart when people share that they've made that decision, and it causes other people to think about it and then maybe make that same decision to join the donor registry and to save a life.
Jennifer, thank you so much for that information. What an important way and a wonderful way to make a difference at the time of your death and leave a living legacy. I'd like to turn back to Jamie and talk a little bit about becoming a living donor. Things have changed a lot in the last 28 years. Can you tell me a little bit about what it's like and what's the process for becoming a living donor?
Sure. So, as I said earlier, 28 years ago, I had to do all the work. I sought out UCLA, I sought out the Living Donor Program, had to create all these relationships and create my own network in order to become a living donor. And it's totally different now. The process of donating and recovery is also totally different. So at the time of my donation, I was hospitalized for 6 days, had a huge scar on my back and a couple of broken ribs while they were trying to take out a kidney in a very invasive surgery. And then it took me about 6 weeks to recover, and then I was able to return to work. I think the important thing to realize about that is that was the only impact to me. My life is normal. I don't have to do anything differently. I don't limit my activities. I don't really limit what I eat or drink. I don't eat a high protein diet for that reason, because I only have one kidney. I don't take a lot of ibuprofen for the same reason. But other than that, my life has been completely normal. And I think it actually reminds me that I need to be healthy, right? More so than most. Now, though, living donation is everywhere. The access is so great. You can go on Facebook and follow hundreds of web pages or Instagram about living donor networks, where you can actually join a network if you want to donate to someone that you're not a match for, one of your loved ones, and they'll do donor swaps, where one person in your family can donate to someone in another family, and everyone ends up with the kidney that they need, and they've still been able to impact their loved one's life by participating in that. So it's just really, really easy now to become a living donor. And anyone who's qualified to be, or I guess I should say diagnosed with a condition, primarily liver or kidney, where living donation can make an impact, all you have to do is go to a doctor's appointment with your loved one and indicate that you're interested. So again, it's just really accessible. And the donation process now is so easy, especially with a kidney. It's primarily laparoscopic. It doesn't even take an hour in some cases. Very small scar, maybe 1 to 2 inches, easy recovery. And again, the same limitations, of course, we need to take care of our one kidney that we do have, but it is much less invasive, easier to do, and easier to access now than it was before.
Wow, such an enormous and powerful gift, the best gift you can possibly give, the gift of life. Well, thank you, Jamie and Jennifer, for sharing your stories and helping to raise awareness of the importance of organ donation. And we hope that you will look into it and find out more about how you can help save a life. For resources and information, visit donoralliance.org.